AM 1450, FM 99.3, KNSI. Welcome to Your Health, produced in cooperation with CentraCare. Today, we are going to talk about you and your kids. We have a couple of experts in studio that are certified child life specialists. Brittany Spah.
Yep, that's correct.
And Stephanie McNaughton.
Correct.
All right. Welcome, ladies. Good to have you in studio.
Thanks for having us.
First question. I've never heard this term before. A certified child life specialist. Brittany, what does that mean?
Sure. So as a child life specialist, my role is to help children and their families cope with a healthcare experience. So we know that the medical setting has the potential to be scary, confusing, and potentially traumatic for infants, children, and teens. A child life specialist's primary goal is to decrease the anxiety and stress during this time.
So how does it happen? I show up at the hospital. I show up at the plaza, right, with my kids. Oh, something's wrong. Do you guys just take it from there? Do you sit with us? Do we have meetings? How does it all work?
We work really close with the patients' families and healthcare team to kind of help create a coping plan for each individual child and family to best support their needs, depending on why they're there, what their diagnosis is, what their kind of plan looks like for.
Sure. Stephanie, how long have there been certified child life specialists at CentraCare? Is this something fairly new?
Not fairly new within the last couple of years, but I would think that about 15 years now that there have been a child life specialist. Within the last 8 years is when we became a two full-time child life specialist program. Prior to that, it was just one child life specialist and then adding on part-time. And so now kind of recognizing the need both at the hospital and out at the plaza for some of those different areas, recognizing the need and the benefit of child life specialists. So increasing our program.
How long have you guys been doing this?
I have been at CentraCare for about 6 years and have been a child life specialist for about 10.
All right.
And I have been with CentraCare for almost 8 years and also 10 years as a child life specialist.
Well, let's talk about this need for a child life specialist. Where did it all come from? Is this something that when you graduated from high school, you knew about this particular branch of medicine, if you will, and this is what you thought you should be doing with the rest of your life?
Sure. So I didn't have that. Child life is something that most people stumble upon either in school or from a personal experience.
Yeah.
So that was the case for me. I was in the hospital myself as a young adult and was going the route of working with children and thought this must be something that's really scary and hard for kids to go through if I'm having a hard time going through this.
Yeah.
And so that kind of led me to the path of child life and wanting to help support these kids, empower them to know what's going on when they are there themselves, and really have a good experience.
Steph?
Kind of similar. I had a parent who ended up being in the hospital for 5 weeks and kind of during that time recognized, the feelings that I myself had of not really necessarily understanding everything going on or kind of those scary feelings and, seeing a parent for the first time and just kind of being in that environment. Like Brittany, I also knew that I wanted to work with kids. And then this experience also kind of helped me recognize my desire to be in a hospital setting as well, that there is a great need for psychosocial care within the hospital.
I think the first time that I was ever exposed to people such as yourself, I was standing in line in grade school going to get my shot, right? DPT probably or something. And they had the gun. Right. And it's way different these days. I understand that. But my first child life specialist said to me, do you want to shoot an alligator or a buffalo? And I said, bet. And before I could even get it out, boom, she'd pulled the trigger. Right. So child life specialists taking the fear, taking the anxiety out of particular situations. Is that about right?
That's exactly right. Yep. And it sounds like what you had was the power of some distraction to help take your mind off of it. Yeah. And it works really, really well for kids. Sure. And their families.
Misdirection, redirection, whatever you want to call it. And I live to tell the tale, so that's really, really important. You are listening to Your Health, and we are talking about child life. Wait, I want to make sure I get this correct. Certified child life specialists. What do they do with your children? What do they do with you, Mom and Dad? We'll find out a lot more. Brittany Spah, one of our guests, Stephanie McNaughton, the other, and you are listening to Your Health, AM 1450, FM 99.3, KNSI. AM 1450, FM 99.3, KNSI. Back with more of Your Health, a certified child life specialist. And our experts in studio, Brittany, Spah, and Stephanie McNaughton with CentraCare. Ladies, again, the role of a child life specialist within a healthcare team. And just kind of break it down. What happens, right? The typical scenario.
Sure. So that really varies based on the setting we're seeing the child and their family, why they're in, what their diagnosis is, if they're going to be having any tests or procedures, that sort of thing. So our role is very powerful within the healthcare team to help decrease the fears and anxiety for kids and their teens. We collaborate really closely with the entire healthcare team to help create that plan of care that will work best for this individual child and their family.
What kind of illnesses are we talking about here? I mean, I could imagine a cancer diagnosis, for example, right? Sitting down and walking everybody through that. I can imagine somebody fell off their bike and they've got blood everywhere and they need to calm down just a little bit, right?
Yep.
And here, you're in the right place. Everything's going to be okay. Just bringing everybody down.
Yeah, really helping that child understand why they're there, what kinds of things are happening. Because when they understand what's happening, they're more likely to feel comfortable with it and feel in control of the situation because they know what's going on.
Hey, who's harder to take care of, mom and dad or the child?
We have found that when you support mom and dad,
Okay.
they are really able to help be a strong support system for their child, too.
Sure.
And so it's really a big picture. And like you were saying, we do work really close with those maybe oncology cancer patients or trauma patients, but we also recognize the need to work with kids who are maybe in for a one-night stay. That's a really big deal for the family, and so we recognize that. Or the kids who are coming in for a well child visit and need injections that day. And so we really meet the kids and family with where they are at and recognize that what they are going through is hard for them,
Right.
and we want to make that experience better, whatever it might be.
Okay, so you work a lot with pediatricians, right? Really closely in harmony. What about pediatric nurses, right? Because isn't that kind of like their job, or is that a little bit different?
Sure. So the expertise of the pediatric nurse is really managing the medical aspect for a patient, where a child life specialist goal is to focus directly on supporting the coping needs of the patient and family. So, for example, if a nurse or provider would be performing a medical procedure,
Okay.
the child life specialist's role is to help the child understand what will be happening, why is this happening, and then working with the child and family to develop a coping plan. So do they want distraction? Do they want to sit on mom or dad's lap? Do they want to watch what's happening, or do they want to look away? So what kinds of choices do they have in this situation? And then we really work with them during the procedure as well to help follow through that coping plan. And so help make sure that kind of what we talked about ahead of time is happening for them so that, again, they can stay in control of what's going on.
The light is starting to come on in my head. So, for example, it's plan ahead, right? If you know something's going to be happening, sit down with the two of you. Let's make a plan. Tell me more about your son, your daughter. Tell me more about you. I don't want you passing out on the floor, that kind of thing, right?
Yeah, absolutely.
It must be extremely gratifying to do this.
Absolutely. It is. There's a lot of really rewarding parts of our job, and really being able to watch a child go from being really, really nervous, not understanding, and helping to empower them, giving them the skills that they need, and coming up with that coping plan and watching them successfully get through their procedure is really incredible. And it's just fun to see that after, they were so scared, but then they were able to do it. And now they have the skills that they can use and build upon for future procedures or experiences that they might get into.
Kids are so curious, aren't they? They want to know all these. I think the folks, probably the parents, would be a little more apprehensive sometimes than the kids would be, because kids just want to know what's happening. What does this light do? Why is that on? What you know what I mean? Is that true?
That's very true. Yeah, they are very curious, and kids are amazing. They don't know to be scared of certain things that as adults maybe we already have a fear of. Right. And so by giving them the control and by giving them the knowledge to know what's going on with them and what's happening really puts them in a place where they can feel empowered versus feel scared of a situation.
Sure. We mentioned, getting shots, right? Golly, do I remember taking my 3 daughters in to get their, annual shots or whatever they had to have, whether it be for school or the vaccines or what have you. Boy, can you give me some examples, Stephanie, of, how do you distract? How do you redirect? Or how do you take the edge off?
Absolutely. So if you know that a child is, if your kid is going to be going into the clinic to have a procedure, have their injections, you can start talking to them about this. Let them know ahead of time that it's going to happen. And that way you can really start working on your own plan as a parent working with your child. What are we going to do? Even though, we as parents, we maybe know that kids are not going to be super thrilled about going, but letting them know what are our options, what are our choices. So where do you want to sit? Do you want to sit with me on my lap? Do you want to sit next to me? Do you want to sit by yourself? That's a choice that a child can have. And then for some distraction, it could be something like playing I Spy with what's in the room, using your just surroundings and talking to them about the different pictures or colors. If it's an older patient or a teen who maybe has their own phone, they can pull out something on their phone or listen to music. Bubbles are a great distraction as well. And that, another great way for a parent to get involved as well and have a job and blow bubbles for their child or have their child blow bubbles during the procedure.
You mentioned teenagers. What is the age parameter of kids that you help? I'm sure infants, right? But all the way up to how old?
Here at CentraCare, we see patients 0 to 17.
Okay, that's a pediatric.
Yep, that's what our pediatric
department, whatever.
Yeah.
Sure.
Yep.
Okay, who's harder to deal with, little ones or big ones?
That's a tough question. That I think it really just depends on the child and the patient and what they're going through at the time. I don't think we can say that all teenagers are really difficult or all school age or all toddlers. I mean, everybody has their challenges, but there are certainly older patients, those older school agers or teen patients who they may never have had an IV before, or they're really afraid of needles too. Mm-hmm. Whereas maybe we can talk with a 5-year-old who isn't as scared of it for whatever reason. So there's just differences between every patient. And that's kind of where we come into that we can help assess the need for these patients, that we maybe can sneak into a room and talk to a teenager about their procedure, and find out that, no, they've never been in the hospital before. They've never had an IV before. They've never experienced any of this. And yeah, actually, I maybe would want someone in here to help me out with it, or I don't want to watch. So that's part of our role too, is going in to assess the different needs for all the ages of kids.
So think back again to when you were kids growing up. Why didn't they have these people, right?
Exactly. Yeah.
What's the reaction from moms and dads when they find out that you are there, the liaison, somebody to talk to?
Yeah. And so the response that we get by addressing the individual needs for each kid and family, what we're really telling these parents is your child matters to us. And we know that supporting the emotional needs of all involved really creates that strong support system for the child when they're there. Mm-hmm. And so we know that when a child is hurting, that parent is hurting. When a child is scared, that parent is scared. Likewise, if a child is feeling empowered, the parent does too. If a child is laughing, the parent is. Mm-hmm. And so we know that the goal of a child life specialist is to help the children and parents discover the coping techniques that work for them and then feel empowered to utilize those right now and in the future as well.
Okay, I tell you what, we're going to take a break, but when we come back, I want to get more specifics. It sounds like it's an awful lot of fun. It
most
can
of
be.
the time.
Right?
Yep.
Okay. AM 1450, FM 99.3, KNSI. Yeah, we're going to find out what fun is. Brittany Spah is our guest, along with Stephanie McNaughton. They are certified child life specialists at CentraCare. You are listening to Your Health, AM 1450, FM 99.3, KNSI. AM 1450, FM 99.3, KNSI. Welcome back to Your Health. We are talking with a couple of certified child life specialists at CentraCare, Brittany Spah and Stephanie McNaughton. Ladies, I can't imagine what it must be like to have to deal with hysterics, right? Because it happens every time. I've seen it. Heck, I've lived it. But what do you do? I mean, if a child just needs to relax, but they just won't, and that gets mom and dad fired up even more, what are some of your tried and true techniques? And here's why I'm asking this, because maybe moms and dads in talking with their kids ahead of time, maybe they could use a tip or two. So have you got some suggestions at, some of those that are back there in the bag of tricks, things that we can use to relax not only ourselves, but maybe our kids? What do you say?
Yeah, well, we know that, for one, crying can be a very appropriate and normal response for kids.
Do you tell them that?
Mm-hmm.
Okay.
Yep, and that's okay if that's a very appropriate way to express yourselves. And so one thing that we really focus on when we're talking with kids is giving them a job to do. So maybe your job is to hold your arm nice and still while we do this. So then we can really focus on the positive things that they are doing, that crying is okay. It's okay to not cry. It's okay to look away. It's okay to watch this distraction. Your job is to keep your hands still.
Yeah.
And really help reinforce that you did your job, you kept your hands still, no matter what their emotional reaction is to it. We know that when they get to the point of hysterics, let's take a break if we can, and let's refocus and see what we can do to make this a little bit better.
Okay.
And so...
Does that work? Taking a little bit of a break?
It really can, to help to settle the child, help to settle the parent. And maybe we can use that time to assess as a healthcare team and with the kid and family, what's going well, what isn't going well, what can we do going forward? Are there other interventions that we can do as a team to really support this? Sometimes the hysterics come after everything is done, or it's already to a point where it's almost done. And then we look at what can we do next time if we have to do this, or for the next procedure. How can we make this even better than we have this time to really help support them going forward?
Well, Stephanie, how about talking to mom and dad like ahead of time? Do you schedule appointments to have folks come in, or how does that whole thing work? Coaching, I guess.
Yeah. So typically we would wait until, if it's a clinic appointment, oftentimes we would get called by the pediatrician or the provider who's seeing that patient for the day. And, they'd let us know that the child is really anxious or upset, or can you just come over and kind of talk with them, or what can we do to help support them? So we can go over there. But, as a parent, it's okay to ask your clinic, or ask if there's an upcoming hospitalization for whatever. You can always call the clinic, ask the hospital if there's a child life specialist who would be able to either, see them during their visit or their hospitalization, or if it's something that they see, a really high need that their child just is really nervous to come. What do I do ahead of time? Oftentimes we're able to call a parent and talk with them over the phone and give some support over the phone of what can we do before you even come into the clinic, or how do I talk to them about coming to the clinic? You
guys remind me of the movie Patch Adams, right? Have you seen that a million times?
Yeah.
So basically, was that kind of like the whole beginning of all of this? Let's put on a clown nose and make the kids laugh a little bit while we're taking a little bit of blood or what have you.
Yeah, so it really comes down to bringing things down to a kid's level. So we know that kids learn and express themselves, and they can really cope better if they have the chance to be a kid, if they are given the opportunity to play. And so we look at what does this kid need? Some kids need that play. Some kids, we have 2 3-year-olds who just want to watch what's happening.
Sure.
And, if we try and bring that stuff out, then they get more frustrated
that curiosity
at that.
Again.
Because, I need to know what's going on right now. And so that's where it comes down to really talking with the patient and family to know how can we as a healthcare team best support you. So
are you, I guess, quote unquote, on call and you just flit around wherever they need you the most? If you're not scheduled to be with someone at 10:15, somebody pops in at 9:45. Oh, we need you over here. Boom. Is that how that works?
Yeah, so we primarily work on the pediatric unit at the St. Cloud Hospital and the pediatric short stay unit at the CentraCare Plaza. But we are available by consult throughout the St. Cloud Hospital and CentraCare Plaza. And we've talked to other patients at other sites over the phone and things like that.
Okay.
So we do have kind of our schedules for the day, but then we go where the needs are.
It usually turns out pretty well, I bet.
Yeah, and even if an experience for a patient is not so amazing and wonderful. And, they're not just like, oh my gosh, do this again. That's okay.
On a scale of 1 to 10, if it's only a 5, that's okay.
That's okay and they still accomplished the procedure. They got what, the goal was to get this done, whether it was the injection, an IV start, a CT scan, whatever it was.
Sure.
Even if it was a challenging procedure for them or they were anxious, they still got it done. And that deserves praise. And that, then we can go back and say, what worked this time? If you need this again, what should we do differently? And so I don't know. I don't know of specifics off the top of my head, I guess. But
well, you know what that tells me? That's a good thing in my book, because it tells me that nothing really stands out as something bad, right? Mm-hmm. But perhaps more importantly, after it's all done and you've been dealing with a difficult child, maybe some difficult moms and dads, is there something that you do typically to kind of bring closure? I think, see, that wasn't so bad. Rub a little dirt on it. You'll be fine, right? I mean, you're not going to say that, but do you know what I mean? Is there typically a closure thing that you would say?
I think recognizing and helping the child recognize how proud they can be of themselves can kind of be a good way to kind of help close this, that we often see kids coming in or hear parents coming in that we can't do this. I can't do this. How am I ever going to get through this? And like Stephanie said, our goal as a healthcare team is to help them accomplish what they need to get done in a way that is best supportive for the kid and family. And so just helping them recognize what they did and how proud they should feel of themselves helps with the healthcare experience, but then they can really carry that feeling on onto life.
You make them part of a team, right? Perfect.
Definitely.
Okay. Mom and dad need to write down your phone numbers so the next time they have a visit coming up, they know what to do. How do we reach out to Brittany Spah or Stephanie McNaughton?
I would say really starting with your healthcare provider or the clinic or whoever you're going to see, and just asking them, depending on where they would be going, is there a child life specialist available who we could either speak to, or oftentimes a provider is able to let us know, hey, we have this patient coming in. Mom has a lot of concerns about this. Are you available, to come and assist when they get here? So really starting with your pediatrician or your primary care provider.
Perfect. You guys, thank you so much for coming in today. Big time education.
Well, thank you for having us.
Thank you.
You bet. Our guests this morning, Brittany Spah and Stephanie McNaughton, child life specialists, certified child life specialists at CentraCare. You've been listening to Your Health, AM 1450, FM 99.3, KNSI.